Hello everyone, welcome back on Meds. I'm your host Mr. Meds aka King Meds inkosi yamakhambi xa nindibona nibothi aza neyeza. Today I just want us to tackle the topic of prescriptions. How do you interpret prescription, how do you read prescription, and how do we verify prescriptions as pharmacists? So I want us to go in details about the whole prescription. I'll tell you everything that needs to be on the prescription for us to consider it as a valid prescription. So in this video I will use 3 examples of prescription. One will be schedule 3 or 4 prescription, schedule 5, schedule 6 prescription. I'm using all these examples because each schedule have different rules about how the prescription should look or how the prescription should be. So that's why I'm using 3 different schedules. Schedule 4, from schedule 4 going down to schedule 1 and 0, prescription is generally the same. Schedule 5, it's a bit different from schedule 4, but it's also different from schedule 6. And then schedule 6 is totally different from the rest of the schedules. The reason I'm making this video is that I've seen people getting angry when we told them that the prescription is invalid. And when we say the prescription is invalid, there is actually a valid reason for that. Because a prescription must follow a certain criteria. There are rules on how to write a prescription. There are details that a prescription should contain. Without those details, then a prescription might be considered invalid. When we tell you that the prescription is invalid, we are not trying to be hard. Remember, pharmacies are also businesses. They're trying to make money. There is no way they will deny you medication. There's no way they will deny making money. So there is always a valid reason for that. Dispensing an invalid prescription as a pharmacist can have severe consequences. In some cases, you can even lose your job. So it is very important to know how to validate a prescription. All these rules are put in place to protect you as a consumer. It's not about protecting the pharmacy, it's about protecting you as a consumer. If we as pharmacists neglect these rules, then that means everyone has free access on medication, and misuse of medication can have severe consequences. Most medication we keep in the pharmacy can easily be used as street drugs, so it is important for us to protect the medication. As pharmacists, we are guardians of medication. We must protect medication and also protect the people. If we don't follow this rule, we will be easily building a country of addicts, as we already have a problem with addiction in this country. But these rules help to limit or restrict addiction. If we don't follow them, we will build, almost everyone in this country will be addicted to medication. So for a prescription to be considered valid, it must have the doctor's details, it must have the patient's details, it must have the date, it must have the drugs, when it comes to drugs or medications name, it must have the strength, route of administration, and the duration. And then it must be signed by the doctor. I asked ChatGPT to generate 3 scripts for me, for us to analyze. The first one is gonna be this one, the one that's showing on the screen. This is a script of Mr. John Doe. I want us to analyze that John Doe script. I'll tell you what does every detail in that script mean. And what would make this script invalid? I want us to discuss that. The prescription must have the doctor's name. As you can see there, it's Dr. A. Smith. And it must have the doctor's qualification. As you can see there, it's MPCHB SA. And then it must also have the MP number. What does an MP number mean? An MP number is a medical practitioner's number. So it is a number that is issued by their regulatory authority, which is HPCSA. So every health professional has a statutory body. So for you to be recognized as practicing, you must register with your designated statutory body. For example, if you're a nurse, you have your own statutory body. Doctors have their own statutory body. pharmacists have their own statutory body. Dentists, I think they still fall on the doctors with the doctor's statutory body. So everyone has their statutory body. So for you to be recognized as a practicing professional, you must be registered with that statutory body. So when you register with the statutory body, they give you the number. So that number becomes your identity. Doctors will have MP number, pharmacists have P numbers, dentist, I think it's the N number. With nurses, they will have NS number. So every professional will have their numbers. Even if you complete your qualification as a doctor, if you're not registered with your statutory body, then you won't have that number. Then you are not allowed to practice. You basically just have a qualification. You are not allowed to practice until you register with your statutory body. Without that MP number, the script is considered invalid. So if the script doesn't have that MP number, then it's definitely invalid. So we can't dispense that script. So how does the MP number help us as a pharmacist? So as I said, each professional have their own MP number. So even with doctors, intern will have a different MP number from a ComServe doctor, or from a qualified doctor will have also a different MP number. So how do we read these numbers? If you're a qualified doctor, it will say MP and then there's numbers afterwards. That means you are a qualified medical practitioner. An intern's MP number will start with IN, so that means they are intern doctors, and their scope of practice is also limited. So as a pharmacist, you must be able to identify the prescriber and their scope of practice. So for example, an intern doctor can't prescribe outside their premises. If the doctor, let's say intern doctor, is practicing maybe eMalahleni Hospital, they can't write a prescription that will go outside that hospital. So the prescription can only be dispensed in that hospital. Even inside that hospital, the prescription must be co-signed by a qualified doctor. So as a pharmacist, you must be able to look for that, because dispensing a script of an intern in a different pharmacy can have dire consequences. Another example is if the prescription is from a dentist. As I said, if you're a dentist, then it's gonna be a DN number. So also dentist, as a pharmacist, you must know the scope of practice of a dentist. So let's say, for example, you get a script from a dentist and they prescribe antidepressant. You can't dispense that. A dentist cannot prescribe antidepressant because they have their own scope of practice. Same thing with the prescribing nurse. So their prescription can only be dispensed in the premises that they are practicing in. So it's usually the clinics, so they can prescribe the clinic, and the medication can only be dispensed in the clinic, not outside that. So you can't get a nurse prescribing medication that will be dispensed in another pharmacy. So it doesn't work like that. So the MP number helps a lot. It helps us to identify the practitioner itself. Then below that is the practice number. So the practice number is basically the number that is given to that practice. Each practice is given a number, so that number is considered as a practice number. So it becomes an identity of that practice. For example, if we say now eMalahleni Hospital will have their own practice number. No institution is allowed to operate without a practice number. It's very important. That is like the identity of that practice. Even pharmacies have their own practice number. As I said, every institution, every medical institution must have a practice number. So if a prescription doesn't have a practice number, then prescription is invalid as well. So you can't dispense it. Then it must also have the doctor's contact details. Just in case we have anything to ask for as pharmacists, we must be able to contact the doctor. So if there are no contact details as well, the prescription is also invalid. It must also have the doctor's address. I forgot to add address on this prescription. So there must also be a doctor's address on the prescription as well. When it comes to patient's details, there must be a name and surname of the patient. So the prescription must have a name and surname. If there's no name and surname, how are we supposed to know whose prescription is this? So we must be able to identify that this prescription is meant for the person that we're dispensing medication for. Otherwise, without name and surname, that prescription is not valid. Age, it's not that important, but according to the Medicines Act, there must also be identity number, the address, and contact details of the patient, but those are not really important because of the POPI Act as well. We can't be writing all the details of the customer. So those are not really important. Some prescriptions have it, some don't have. It doesn't matter. Then the date. The date is also very important. So this is basically an acute script. It's just for a few days. So it's an acute script, it's not a chronic script. So with this script specifically, the date is very important because the script is only valid for 30 days from the day it was written, you see. So this script is dated the 22nd of September 2025. So this means this script is valid until the 22nd of the 10th month. So this is because September has 30 days. Yeah? It's because September has 30 days. If it was maybe August with 31 days, then it would be like valid until the 21st of September, you see. So it's 30 days straight, not 31 days, 30 days. So you have until the 22nd of October to fill the script. This one specifically, you have until the 22nd of October to fill it. After that, the script is invalid. It's just another piece of paper. You won't be able to do anything with it. For me, I feel like that 30 days is too much for acute script. If it was up to me, the script will be valid for the duration of that treatment. So if the treatment is for 7 days, it will only be valid for 7 days. For 20 days, it will only be valid for 20 days. But it's according to law. I don't make the law. I don't make the rules. I follow them. If you get the script in the beginning of the month, you were sick in the beginning of the month, and you collect your script at the end of the month, you probably will not even sick anymore. But I don't make the law. So you have 30 days to fill your script. Let's go to the item on the script. So this one is amoxicillin. That is not a brand name. That is actually the molecule name. So you can get any brand if the doctor prescribes it like that. So it's amoxicillin 500 milligrams capsules. So 1 capsule 3 times a day after meal. So in this one is at 21 tablets or capsules. He could have also wrote it in a different way. He said 1 tablet 3 times a day for 7 days. You can calculate, we can calculate that. It's easy as well. It's 21 capsules. And you can see at the bottom of the script, there's a signature of the doctor. Without that signature, then it's invalid as well. There must be a signature. Otherwise, the script is not valid anymore. As you can see, it's Dr. A. Smith, he signed. Okay, let's go to our second script. So this is the script of the same customer, John Doe. As you can see, there are doctor's details, there's the doctor's contact numbers, and then there's MP number, practice number. The script is valid. And then the doctor prescribed amlodipine 5 milligrams tablet, 1 tablet daily in the morning. Amlodipine is your generic name, Amlog, Lamanor, Siblavasc, you name them, there are a lot of them. So this doctor used the active ingredient name to prescribe. So that is actually very good. So they use the active ingredient name to prescribe. And then it said amlodipine, 5 milligram tablet, take 1 tablet once a day in the morning, and then the quantity of 30. And he also put 2 repeats. What does this mean? This means the amlodipine, the John Doe is gonna be using the amlodipine for 3 months. So it's the first repeat is the one that is written, and then there is 2 more on top of that repeat. So that means there's a total of 3 months. What do I mean when I say 3 months? 3 consecutive months. You skip a month, you lose your repeats. You skip 1 month, you lose that month. So this script is valid until the 22nd of January. You see, because it's from, let's say, 22nd of September to 22nd of October 1, 22nd of October to 22nd November 2, 22nd November to 22nd of December 3. So okay, it's valid until the 22nd of December. So that's 3 months. So when I say 3 months, if you skip 1 month, then you lose that repeat. Let's say now you decide not to come between the 22nd of October and the 22nd of November. Then you lose that month. When you collect in December, you're collecting your last repeat. You're done. You're collecting your last repeat in December. So it's 3 repeats, 3 months, whichever comes first. If you decide to collect early, for some reason, maybe you collect early and then your script expires maybe in November, it's done. So it's 3 repeats, 3 months, whichever comes first. Same thing as if maybe it was a 6-month script, they would say repeat 5. So there's the original script plus 5 repeats. So it's 6 consecutive months, 6 repeat, whichever comes first. So if the 6th month comes and you've only collected 4 times, it's your problem. The script is expired. It's your problem, the script is expired. If for some reason you decide to collect all 6 repeats within 3 months, then the script is also expired because you got all the repeats, you see. So whichever comes first, repeats or month, it expires. This is according to the law. A script can only be valid for 6 months. So it can't prescribe a 12-month script. It's not allowed. Script can only be valid for 6 months. They can only prescribe repeats for up to 6 months. So up to 6 repeats. They can't put 12 repeats. There's no way we allow that. That is according to Medicines Act, only 6 repeats. Why is this the case? This is because after 6 months, the customer or the patient must go for a checkup to make sure that the medication that they are using is still working correctly, you see. So they must go for a checkup after 6 months. So I remember during COVID, the doctors were allowed to prescribe up to 12 months. That was just to limit the movement of people. But as soon as it ended, then we're back to normal to 6 months. So you're not allowed anymore to prescribe more than 6 months. And the second medication is enalapril 10 milligrams twice a day, so it's 60. So this one is not repeatable, it is just once off. So that means you only have 1 month to collect. What do I mean 1 month? I mean you won't be able to take it at the end of the script. You have from the 22nd of September until the 22nd of October to collect enalapril. Then you're done. You won't be able to get another enalapril. And then there's a doctor's signature to validate the script.